I think it's an important transparency effort because, again, the federal government started requiring that these prices be posted, but then there is no central location where all this data should live or can live. So it's really up to journalists and researchers and whoever really has the interest to take this on.
I'm Justin Silverman of the New England First Amendment Coalition. The following conversation is part of our First Amendment and Free Press program, where we pull the newsroom curtain back and explain how journalists do their jobs and the role that they play in our democracy. You can view all of our discussions at nefac.org/1A Free Press. I'm here today with Mary Katherine Wildeman, a reporter at Hearst, Connecticut Media Group. Mary Katherine, thanks for joining us.
Thanks so much for having me.
Mary Katherine, you recently took a comprehensive look at local hospital and insurance costs, a topic that I think most people probably don't give a whole lot of thought to, but a topic that affects all of us and can affect us differently depending on the community in which we live. Can you tell us a bit more about the story? Give us the background of your reporting and what you found?
Yeah, so a lot of journalists are probably aware that in January of 2021, hospitals had to start disclosing the rates that they previously secretly negotiated with health insurance plans. This is big data. A lot of hospitals didn't comply right in the beginning. But at this point, at least in Connecticut, most hospitals are sharing some of those rates at least. So the effort on my end was to compile data from, it's about 30 hospitals in the state, again, detailing the rates that they have set with various insurance plans. And so I brought those pieces of data together, and my goal was to sort of make it comparable, so you can start to get an idea of how much you might pay for a certain service at one hospital or with one insurance plan compared to another.
Prior to 2020, this information wasn't available. It then becomes available. How did you get the information? What was your first step in the reporting process?
Yeah, so these prices are required to be shared on each hospital's individual website. Different hospitals are more upfront with those prices than others. That most are now shared on some sort of price transparency page that each hospital maintains. So the long and short of it is that you have to go to each hospital and collect the information in order to gather. There's no central location where you can get this data. So that was one of the challenges that I had to overcome, for sure. You
have 30 hospitals that you're trying to get information on, and so you have to go to 30 different websites. When you get there, is it a simple, click of a button and all of the data downloads for you, or what does it look like when you get to these individual hospital web pages? Yeah, that's another thing that varied depending on the hospital. So for some, it really was exactly that easy, and then for others, not at all. Some are shared in kind of web-friendly formats called JSON. Some journalists might be familiar with that, and then others are CSVs that are, relatively easy to work with. But actually, one of the biggest problems that I had to deal with was just the size of the data in a lot of cases. Some hospitals really just kind of dumped all of their information on the website, which is not a bad thing for journalists and researchers necessarily, but it does lead to some big data issues. So that was another thing I sort of had to contend with. So describe for us some of those challenges, because now you have data from 30 different hospitals. You may have had to jump through some hoops to get the data from individual ones, but now finally you have all of this data in front of you. What does that data look like, and how did you then go about trying to manage that or work with that data in a way that would allow you to do the reporting you did? It was probably the part of the process that took the longest, to be honest. Acquiring and cleaning the data was definitely a big undertaking, but then the question becomes what do I do with all of this? And so I had to choose ways, essentially killing your darlings, choosing ways to narrow down the analysis and just pick out some services, some essentially billing codes that are going to be, I felt would be relevant to people. And then finding ways to describe them to readers, which can be tough. The medical lexicon is not very reader friendly. So
That was another serious undertaking, but yeah, it was kind of a lesson for me in choosing it, just being willing to choose how to narrow down an analysis, right? When you have so much data and information in front of you, you really just have to make your choices, right, about what to include and what not to include, and maybe leave the rest for follow-ups, and just understand that, you know, more can be done with the data later on. It can be kind of like a gift that keeps on giving. So again, that was kind of a long process, but I think we got there, and I think moving forward, I can do that more efficiently, just by being more willing to make decisions. So
once you clean the data, you format it in a way where it's all consistent and you can view it accurately and start to make some decisions about what to focus in on.
Yeah.
How did you go about making those decisions as to what your focus would be, what would be of most interest to your readers? How did you decide, just looking at all of these numbers, you know, how did you determine what was most important?
Yeah, that's a great question. I think it was kind of a continuous process where I would choose some things that I knew would feel important to readers, and then others that made sense for other reasons. Like first of all, I created a cutoff. So if the procedure wasn't reported by more than one hospital or more than one healthcare system, then I just got rid of it. Because again, the goal of this effort was comparison. So if only one shares it, then it doesn't make sense to include it. And then in general, my focus was just picking services that people could shop for, right? So one example that we highlighted in the lead of the story was a C-section. We kind of like looked at various maternity care procedures throughout the story to kind of give it like a common vein. So C-section is an example of something that people can shop for. Sometimes they don't, right? Of course, depending on their situation. So it just felt like a good example for that reason. And I kind of put the data through the ringer that way, and tried to pick things that kind of fit that mold. Included, for example, like critical care services, because I think that felt really relevant to readers and their needs. You can be, of course, with really high healthcare costs if you need a critical care service. And then other things like just psychiatry appointments and therapy and physical therapy and things like that you do typically, you know, shop for and schedule. So I tried to give it a mix.
Now, and I'll have you get to the takeaways in just a moment, but tell us from the moment that you decided, okay, this is a story, this is something I need to look into. These records are now available. Getting those records, cleaning those records, and then, you know, sorting them, arranging them, processing them to the point where you can write a story. How long did that process take? How much time was invested to that point?
It was a lot of time, but as any local reporter can attest, it's something where you're juggling this in addition to a bunch of other stuff you're working on, right? So all told, the process probably took me like roughly 6 months, but that doesn't mean that I was working on it all the time every day, right? So yeah, it took a lot of time, and I would have to step away from it and come back to it, and then could see it with a little bit of a clearer mind. Because again, it's just one of those things where you have to be willing to kill your darlings, and that's really hard to do in the moment. And you come back to it, you're like, never mind, I don't need any of that. So again, that was probably the longest part of the process. And yeah, it probably took me a few weeks of dedicated work.
Right. And for I know many journalists are struggling to do this kind of investigatory, comprehensive work in addition to their day-to-day, you know, responsibilities and deadlines they need to meet. Any advice to them on how you can juggle it all and make it all happen given daily deadline pressure?
It's a great question. I mean, I'm probably about 6 years into my journalism career, so there are people who've been doing this for their entire career. I'm sure have the magic words for that really difficult question. But for me, what I guess I try to do is pick topics that I am morbidly interested in. This being an example, and then it just gives you the energy to dedicate all this extra time to it, right? Not necessarily outside of work hours. I mean, just something that really drives you and makes you feel engaged on the issue. And that can do wonders in terms of getting the work done and getting it out there because you care. And this is something I really care about. So.
All right, so let's get back to the reporting. What did you
Mhm.
find after all of this time invested, all of this work? What were some of the takeaways from your reporting?
Well, it's interesting data, and I think the firmest takeaway we have right now is just that prices can vary really widely by many thousands of dollars, really, without a lot of explanation as to why. We're going to be doing some follow-up reporting, hopefully creating some more analysis and investigating, for example, whether certain health systems or hospitals tend to be more expensive than others. That can be very hard to do. But for example, I'll just go back to the C-section example. We found that even within the same healthcare system, so Hartford healthcare system, the price for a C-section could vary by something like $14,000, depending on which hospital they're going to. Hartford Healthcare owns a number of hospitals in Connecticut. So that's concerning because I tried to pinpoint examples that didn't make a lot of sense. And that's kind of the common vein, again, that we see with these prices and these rates, is that it's very hard to understand or explain why prices should vary so much. So in another example, we highlighted that at the Manchester Memorial Hospital, 1 hour of critical care could cost anything between $800 and almost $4,000 from the same insurer, just depending, that is Aetna, depending on whether an HMO or a PPO is paying. And so these aren't differences in prices that patients would expect to see, I think. And that's an example of one that can't be explained by a difference in quality, right? Because it's the same hospital you're going to, and ultimately the same insurance company that's negotiated the rate, right? So I just tried to highlight examples that really point out these confounding differences in price, and it's going to take more follow-up reporting and research, really, to understand what else the data can tell us, I think.
Why is this reporting important? Why should readers care about all of this information that you're providing?
Consumers have choices to make about their healthcare, right? They can choose where they go to get care. In some circumstances, they can choose what plan they have, right? But a lot of times they don't, actually. And a lot of us don't have the time and effort available to us to make the lowest price decision. It's really challenging. So my goal was really just to point out the extremely high healthcare costs that people can be exposed to for reasons that, I couldn't pinpoint, that I don't think that anyone could pinpoint. And so then in addition to that, I think it's an important transparency effort because, again, the federal government started requiring that these prices be posted, but then there is no central location where all this data should live or can live. So it's really up to journalists and researchers and whoever really has the interest to take this on. And so I think that we should do that. We should commit to pulling together this public data and making it available to patients who do want to try to make their own decisions about where to get healthcare and drive their own costs down. So I think it's those two things mostly.
Thank you. And we should note that through your reporting, you created this really valuable database with all of the information that you gathered. So readers don't have to do what you did and go to 30 different websites, 30 different hospitals. They can go simply to this one database that you created. It's available to the public. Everyone can access it. Why the decision to do that?
Well, I just said that, transparency is really important in this data. So I wanted to make it transparent. And so that's what I did. I put it on my personal GitHub, which is Mary Kay Wild. So you can search me there and you'd be able to download the data set as well as some of my how I got there process. And then in addition, we do have, if you're not a data user or data literate, we do have the prices, a subset of them posted on CT Insider as well. So you can go there to explore it and, find me on Twitter too, or anywhere else. And I'm more than willing to help journalists who are interested in finding this data or even using what I created. So yeah, they should absolutely reach out to me if they need help with it, because it is a bit challenging.
Great. Well, thank you for that, Mary Catherine. This is a great example of public service reporting. Appreciate all
Thank
you
you.
do, and thanks for being here today.
Thanks so much, Justin. Really appreciate your time.